Hi, I'm John Vital, Trak's CEO, and I can imagine that you've ever been in a room like this, in the physical therapist room. But I'm not sure, and please be honest, if you have completed the therapeutic exercise that your physical therapist has prescribed you. This happened to my father, who, as you can see on the screen, had a shoulder injury, and this was what his physical therapist gave him in order to complete the treatment. This exercise sheet, and with it, he couldn't complete the treatment from home, and my father had to undergo shoulder injury. My father or you are not alone. There are more than 2.4 billion patients that need rehabilitation, but there are not enough physical therapists to cover population needs. There are 10 times less physical therapists than what the World Health Organization recommends. Rehabilitation is the most effective way to undergo this treatment, but patients don't complete the exercises from home. So it is clear that physical therapists do have a problem, and in order to solve it, we have created Trak, the rehabilitation solution that makes patients complete the exercises. We have created this software for physical therapists in order to prescribe the treatment and in order to be the treatment to be completed from home. So in order to achieve it, we have created an AI algorithm that corrects patients while they are completing the therapeutic exercises from home. With just the camera of the laptop or mobile phone, Trak's algorithm can correct patients in real time and gather data of the exercise of each exercise for healthcare providers. This is how Trak works. First of all, the physical therapist has to prescribe the most effective treatment for patients. They can do that in less than 30 seconds. Then patients get exercises with the rehabilitation experience that we have shared. And finally, healthcare professionals can see the monitoring and can see the evolution of each patient. This way, our customers can treat up to 4 times more patients, reducing the service cost in 50%. Patients are happy with us, up to 9.25%. And in the first clinical studies that we have done, we've seen that we increase adherence to treatment up to 3 times comparing the standard of care. As I've told you before, this is a huge problem. There are more than 2.4 billion patients that need rehabilitation and just 3.5 million of physical therapists. So obviously there are some competitors, but there are not competitors that have the accessible technology that Trak has. Other softwares do have a wearable or a hardware in order to conduct these rehabilitation sessions. We are 100% focused on physical therapists and doctors, not for patients, and that can integrate the solution into the clinical record or the app of our customers. We've done, we have published three clinical validations, and we are CE marked. We are CE marked medical device, and we have some other ongoing studies in order to prove the effectivity of Trak's treatment. As for the business model, we are a B2B SaaS. We charge per patient to insurance companies or to pharmas, and per physical therapists to healthcare providers. And we are proud to say that we are the digital physical therapy solution chosen by the industry leaders. And in just 2 years, we've managed to work with customers such as Bupa, Teladoc, Mafre, the industry leaders from Spain, but also from Europe and worldwide. Behind Trak, there is a strong team led by the 3 co-founders, and with all the areas that the company needs in-house, the clinical part, the product part, and also the sales and marketing part. And we are guided by an advisory board that help us from the clinical perspective, but also from the management perspective. Talking about traction, we are working with more than 60 hospitals from 7 countries, multiplying per 10 the invoicing and reaching 0.5 million euros this year. So we have achieved all this with just 100,000 euros funding round, and now we are about completing 1.2 funding round. So imagine that what we can reach with this money. We do believe that we have been 100% capital effective. So this is what it is, Trak, and I hope you've liked the pitch.
All right. Thanks for the presentation, John. Quick question. How long is the program? And secondly, is it one time kind of exercise? Or let's say, for example, I broke my shoulder while doing snowboarding 2 years ago, and I feel like I want to come back and so on. Do I need to go back to my physiotherapist and do it again? Or can I bypass somehow and use your Trak?
Yes, thanks, Cedric. So we offer our tool to hospitals. I mean, and there are your physical therapist will prescribe Trak to you, and the physical therapist is who decides the amount of sessions and the length of each sessions. But in average, each patient completes a 30-minute rehab sessions from home, and there are 15 sessions per patient. That's an average, but there are patients that they're doing Trak for a year at least. And there are other patients that only need 3 or 4 sessions in order to be healed.
Okay.
Maybe a question from me. This feels like a fairly competitive space. There's like a lot of established players as well. Could you elaborate on what's your USP?
Yes, I mean, our main USP is that we are designed for healthcare professionals. There are other solutions such as Hinge, Kaya, Sword that there are B2C. I mean, that they offer to the insurance company a solution in order to avoid the hospital. Our go-to-market strategy is to help the hospital to help the physios to help patients and help hospitals to be more productive and to treat better the patients. That's our USP.
And wouldn't it be easy for other players to kind of adopt this as well? You know what I mean? Like, you already have like cover one, let's say, side, and now I guess it wouldn't be that difficult to do what you do as well.
Not really. I mean, we have trained a huge whole software for healthcare professionals in order to help them to monitor from home all patients. That's our main competitive advantage and what makes us different. A software that helps patients prescribe in less than 30 seconds with an AI-powered algorithm, and another software that helps physios to monitor in an easy way how patients are exercising from home. That's what makes us different, and that's where we are working so hard.
Thank you.
Quick question, John, and a very candid one, but at the end of the day, I think I don't totally understand which main pain you're addressing. So basically, are you providing a solution that aims at helping patients to fulfill this post-surgery period that they actually do not do if they are alone at home? Or is it a major pain that you're solving on the healthcare professionals' part? This is what I don't understand at that point in time.
Yes, thanks, Gabriel. I mean, our main focus and taking our customers into account that are the healthcare providers, we help hospitals to be more productive. Because now, for example, some patients has to go, like, imagine 15 times to the physical therapist. And what we make with Trak is to do this hybrid rehabilitation where patients can only go 3 times to the hospitals and complete the rest of the treatment from home. So this way we reduce waiting lists and we help hospitals to make more productive and to treat the patients in a cheaper way. And we are seeing that patients also do appreciate our solution with a high satisfaction levels and with incredible metrics in terms of adherence to treatment. So this is like what makes us that this would be our USP or our value proposition for our customers.
Okay.
We've got 1 more minute for any follow-up questions, or we are good to
Great.
wrap up.
There's another minute. Could you please elaborate a bit on the team?
Mm-hmm.
What is your expertise in the field, and what makes you special?
Yes, thanks for the question. I mean, Carlos and I, which are the other 2 co-founders, we have developed successfully in another startup who was sold. And Danny comes from the AI environment. He developed AI algorithms for drug discovery, and now he is implementing all his experience into Trak. And well, we have senior profiles on top of our major departments, major areas, and we also have like a strong advisory board that help us in our path.
Thank you very much.